Hi everyone, this is Emily Barr. I am one of the co-chairs of the GMDI Education Committee. Thank you all for joining us for the webinar entitled Getting the Most from Your GMDI Members-Only Clinical Tools and Resources. I have the pleasure of introducing our wonderful group of speakers. Our webinar today will start with Nancy Callahan. Most of you all know Nancy. She is the Executive Manager of GMDI. She brings a wealth of experience to our organization. She previously worked as a genetic counselor with over 20 years of clinical practice and 16 years as the director of the Master's Program for Genetic Counseling Training at the University of North Carolina at Greensboro. Nancy has also served in leadership positions on the board of directors of the National Society of Genetic Counselors, the American Board of Genetic Counseling, the Accreditation Council for Genetic Counseling, and the Association of Genetic Counseling Program Directors. She has been with GMDI since 2015. We would like to thank Nancy for organizing GMDI in general, but also for coordinating this webinar. She will provide us with an overview of the GMDI website. Following Nancy, we will have two case presentations. Our first will be presented by Mary Soa. Mary has worked at Chalk Children's in the city of Orange, California for 26 years and in the metabolic clinic for the past 15. She has specialty certifications in pediatrics, nutrition support, and lactation education. As a GMDI member, she has been extremely active, participating in the conference planning, the education committee, nutrition guidelines work group, and now she's our GMDI president-elect. The second case presentation will be presented by Chanel Suarez. Chanel has been a dietitian in Los Angeles, California for 4 years. She spent her first 2 years working as inpatient dietitian, predominantly focused on critical care and trauma. She has spent the past 2 years as a metabolic dietitian at UCLA in the Division of Medical Genetics. Chanel has specialty certifications in pediatric nutrition and is current co-chair of the GMDI Education Committee. Our learning objectives for today's presentation are to identify clinical practice tools and education resources that we can access as GMDI members on our website. Second, to explore strategies to utilize GMDI practice tools to enhance our patient care. And lastly, to describe patient educational and advocacy resources that can be accessed through our website. Now I will hand it over to Nancy.
In the next few minutes, I will be showing you some of the features of the GMDI website. When you enter the website, it's a good idea to log on using your GMDI user ID and password. By logging on, you can view all of the features of the site. There are some features of the site that are only available to members. From the home page, you can see important news items. You can find links to the GMDI social network sites. You can find the GMDI calendar, which includes listings of important upcoming events. You can click on the link to find detailed information about Metabolic Pro. You can also, on the sidebar, find more information about membership benefits and committees. And you can have a very quick access to the nutrition guidelines and toolkits. Another important feature that you can access right from the home page is the Find a Metabolic Dietitian feature. When you click on this link, you will see this site, which allows you to enter a person's name, state, or search by zip code and distance. It's a good idea to be listed in this directory, and you might want to go onto the site and enter your own name and check to make sure that you're listed and that the entry is correct. If not, you can always click on the Suggest and Edit box to ask to be added to the site or to correct your listing. The GMDI website is organized by a series of tabs that are found at the top of the screen when you log on. In the About GMDI tab, you can find lots of information about GMDI, including the mission statement, history, strategic plan, bylaws, information on how to contact us. You can also find information on the current board of directors. In the Membership tab, you can find information and benefits, You can join GMDI, click on the link to find more information about GMDI committees. This is the page that you'll see when you click on committees. As you see, each committee is listed with the opportunity to click for more information about a committee. So for example, if you clicked on the technology committee, this is what you'd see. The chair and co-chair and list of current committee members, the goals and objectives, and the current activities. The Resources tab allows you to get back to the Find a Metabolic Dietitian feature, some patient resources, the nutrition guidelines, and the job connection. As you will note, there's a certain amount of redundancy built into the site in that there are several ways that you can reach some of the key features like the Find a Metabolic Dietitian feature or the nutrition guidelines. This is done on purpose because different people look for things in different ways. If you click on the Conferences tab, you'll find a copy of the program for all of the most recent GMDI conferences. In the Advocacy section of the website, you can find GMDI position statements and advocacy alerts. The Marketplace is where you go if you want to join or renew your membership, purchase a Metabolic Pro license or renew your Metabolic Pro license, post a job notice. One thing to keep in mind is that you should always be logged in before you can place an order on the GMDI website. Once you are logged in, you can access all of the member resources on the site by clicking on the Member Resources tab. This is what you see when you click on that tab. So, for example, you can follow links to update your member information, to get back to the descriptions of the committees, you can also access professional resources, for example, information on the small grant program and job postings, the most recent salary survey. You can also access a list of relevant professional organizations. You can find information about current and past GMDI webinars as well. You can also, from the members section of the website, quickly get to other communications like the newsletter, which, as you probably know, is published each fall and spring, and again get back to information about GMDI social networking sites. From the members section of the website, you can see more detailed information about the last 3 conferences, including the published abstracts. The clinical practice tool is another very important area of the website and is in fact the subject of the remainder of this webinar.
Thank you, Nancy. For the next section of this webinar, I would like to walk you through some of the resources available under Clinical Practice Tools. I'm going to highlight those tools specifically related to MSUD using the example of a newly diagnosed baby. You will start by clicking on Clinical Practice Tools to access these resources. When you first click on Clinical Practice Tools, you will be brought to this page. I'm going to refer to this as the home page. I have taken 2 screenshots of all the resources on the home page. As you can see, there are a number of resources available for you. Once again, we're going to focus on the materials we need for your MSUD baby. Under the Clinical and Education Resources by Condition section, you will see a list of disorders where the resources have been organized by one of the Education Committee members. MSUD was organized by Diane Frazier. Once you click on the MSUD link, this will then bring up the acknowledgement message and a link to the MSUD resources. There are 6 sections under MSUD specific resources: guidelines, diet treatment, education resources, support organization, diet management tools, recipes, and cookbooks. We're going to review parts of 5 of these sections. The third section under the MSUD specific resources is education resources. To help you get started with your new patient, you may like 2 specific links highlighted: the Genetics Home Reference and ACMG websites. The ACMG link has 2 hyperlinks: the algorithm and the act sheet, which guides providers for working up a patient with elevated leucine on their newborn screening test. On the Genetics Home Reference link, you can click the printable PDF overview of MSUD. This printout reviews a brief description, causes, inheritance pattern, diagnosis and management, and resource links, which may be useful for certain families or their pediatricians with a newly diagnosed baby. If this is your first newborn, or if you haven't had an MSUD infant in some time, you can take a refresher course on MSUD. The link to the Med-Ed Mentor courses is under the home page for clinical practice tools, diet-related education section. Med-Ed is an educational website created by dietitians Lori Bernstein and Fran Rohr. Their hyperlink will bring you to the Med-Ed website. Once here, you can click on the online courses, then scroll to MSUD and join the course. You will need to create an account. There is no fee for the course. Dr. Sandy Van Kelkar from Oregon is the instructor for the course. Dr. Van Kelkar walks you through the biochemistry of MSUD, toxicity of leucine, teaches you how to prescribe an initial diet for a baby with classic MSUD, along with prescribing a diet for children and adults. She also reviews the medical food option and goes through a step-by-step diet calculation. There are also online courses available for other conditions on the Med-Ed Mentor website. They include UCD, GA1, PKU, propionic and methylmalonic acidemia, and long-chain fatty acid disorders. In addition to the Mentor course for guidance, you can access the MSUD nutrition guidelines. The link to the toolkit is located here as well. The links live in several areas on the GMDI website, as Nancy showed earlier. If you aren't familiar with the guidelines, they provide you with evidence-based recommendations on managing an individual with MSUD. There are also guidelines for PKU, propionic acidemia, and VLCAD is in the final stages. I'm highlighting here the nutrition recommendation section. Once you click on the nutrition recommendation section, you will see there are 5 recommendations for MSUD. Nutrition intervention during illness, nutrition management of branched-chain amino acid blood levels, thiamine supplementation, nutrition intervention during pregnancy, and liver transplant recommendations. If you click on recommendation number 1, you will see the research question that was used to develop this recommendation: nutrition interventions during illness, trauma, or surgery, and the conclusion statement. The next slide shows the summary and detail tab for this recommendation. Each recommendation may have subtopics. For recommendation number 1, there are 8 subtopics. On the left is the summary statement for recommendation 1.1, which provides guidance to promote anabolism during illness. If you click on the Detail tab, it will provide you with a summary of the formal and gray literature findings supporting the recommendation shown here on the right. Another area in the nutrition guidelines to refer you to is the list of tables. There are a total of 26 tables for MSUD, including those for the case studies. Table 8, recommended nutrient intake for newborn infants with MSUD, can help you guide you as you are developing your metabolic recipe for your new patient. It includes your targets for the branched chain amino acids, total protein, and energy intake. To access the toolkit, you can click on this link, or it can also be found directly on the CERN website. There are some resources in the toolkit that are only available to GMDI members. Here is the menu bar for the toolkit. I am highlighting the case presentation for an infant with MSUD. The case study walks you through calculations, diet adjustments, and monitoring for your infant. As you can see, there are also case examples for toddlers, school-aged children, along with management during illness and pregnancy. Back under the home page of the Clinical Practice Tools is the link to the Nutrition Learning Center. There are 4 separate areas of support for metabolic dietitians on the NLC website: webinars, clinician resources, patient resources, and case studies. I wanted to highlight the materials in the patient resource section. Here you can find resources to help increase your new family's understanding of the diagnosis. The Nutritious Temple Resources has a link to the book and video on MSUD for your new family. Depending on the time you have in clinic to spend with your families, you may consider playing the video and watching it with them, or you can have the family and other interested family members review at home. The book also comes as a PDF and can be printed. The book and video are comprehensive and will walk the family through an overview of the biochemistry, symptoms, newborn screening, genetics, diet basics, metabolic formula, monitoring, clinic visits, illness management, and the importance of the metabolic dietitian and clinic team. You may also get copies from your nutrition rep. Here are a few slides from the book. What do enzymes do? How is MSUD managed day to day? Description of branched chain amino acid free formulas. MSUD management during illness. Your patient is now 6 months old and is ready to begin solids. A few resources for your parents are under the Diet Management Tools section. I will highlight the leucine and protein content of foods list and the diet record sheet. The leucine and protein food list is a searchable PDF and is also in a printable format. When you search for food, it will give you information on the serving size, protein, and leucine content of the food. The MSUD diet record is available in PDF and Word, so you can adjust for your patient population, and there is a Spanish version as well. These tools can begin to help your family understand the leucine content of foods and how to keep track of them. If your new family is looking for additional resources for planning meals, there are a number of resources under recipes, cookbooks, and food lists. Two of these resources we will review on the next slide. The link to the Apples to Zucchini cookbook will give the family information on how to order the cookbook from Nutritia. The second link is the low protein grocery list in English and Spanish with foods available at several markets, including Trader Joe's and Walmart. The last resource section I would like to refer you to is the MSUD support organizations. There are hyperlinks to organizations to help your families connect with other families who have children with MSUD, such as the MSUD Family Support Group and NORD, along with several others. On the MSUD Family Support Group, the families have access to a quarterly newsletter, and there are video clips of the presentations at the last MSUD symposium. Now I'd like to turn the webinar over to Chanel.
Thank you so much, Mary. For the next section of this webinar, I will be placing greater focus on patient education and advocacy resources that are available on the GMDI website. I will also briefly touch on resources that can be utilized by both practitioners and patients and their families, which can help aid in the understanding of a metabolic disorder and its treatment plan. To highlight these tools, I'm going to work through a case study of a child with homocystinuria who is establishing care at a new metabolic clinic. To begin accessing these resources, you will start by clicking on Clinical Practice Tools, exactly the same way that Mary got started with locating resources for the MSUD example. As you will see, homocystinuria is one of the disorders that has resources that have been organized by one of the GMDI committee members. I would like to give a special thanks to Danielle Weiss, who was very instrumental in organizing the resources for homocystinuria for GMDI members to utilize. Once you click on the homocystinuria link, this will bring up an acknowledgement message to connect you to the homocystinuria resources. The second section under the homocystinuria specific resources is educational resources. To help both you and your patient's family with the understanding of homocystinuria, two specific links which can provide great overviews of homocystinuria are highlighted under educational resources for professionals. The first link leads you to the Genetics Home Reference website, which, as many of you may recall, Mary referenced earlier as well in her MSUD case example. On the right-hand side of the slide, you can see a screenshot from the Genetics Home Reference homocystinuria page. The printable PDF can be a really great resource to provide certain patients, families, or even other health professionals that are members of the patient's care team with a nice synopsis of what homocystinuria is and its management. The second link guides you to the New England Consortium of Metabolic Programs website. On the right-hand side of the slide, you can see a screenshot from the New England Consortium of Metabolic Programs homocystinuria page. One of the reasons I specifically wanted to highlight this link is because we know that every patient and their family has different learning styles. And it's very nice to see that there are different resources available in your toolbox to utilize for your specific patient and their family. This website in particular has a very helpful frequently asked questions section, which can be useful in helping to guide a discussion about homocystinuria during a clinic visit with a patient and their family. This can also be provided as a nice reference for after the clinic visit to guide your families with answering frequently asked questions. The second section under Education Resources is Journal Links. The first journal link highlighted can be seen in a screenshot on the bottom right-hand side of the slide. Especially for a metabolic dietitian or clinic that is not too familiar with homocystinuria, this particular journal link highlighted is very important as it provides evidence-based treatment guidelines for the management of homocystinuria. As many of you know, clinic visits can be very busy, and we often give patients and their families a lot of information all at once. It can be really great to send patients and their families home with educational materials that reinforce the education that was provided during their clinic visit. The next slide will highlight a few of the patient and family-friendly educational resources that are available through the Nutritia Learning Center. The introductory information booklet, shown on the left-hand side of the slide, gives a good breakdown of homocystinuria, including the pathophysiology, treatment, and prognosis. This booklet is also available in Spanish and has very nice visual aids and easy-to-follow information related to homocystinuria. There is also a fact sheet available, as shown on the right-hand side of the slide, which is a nice 2-pager that briefly provides a breakdown and background of homocystinuria and the treatment and management overview of the disorders. Both the introductory information booklet and the fact sheet complement each other very well. The fact sheet in particular is very great for families to provide different caregivers or their child's teacher or school to inform them more of the disorder. Now we will switch gears a little bit. You will find the first section under the homocystinuria specific resources is clinical practice tools, which help with the diet treatment of the disorder. Under this section, you will find a link to Metabolic Pro, which can help you to analyze the nutritional profile of your homocystinuria child's metabolic formula. This can be very helpful, especially after a long day, to double check your formula recipe. The next slide will show Metabolic Pro in a bit more detail. In step 1, you will create a patient profile with some basic information like disorder, date of birth, gender, height and weight, and physical activity. Next up, in step number 2, you will input a formula recipe. Metabolic Pro is very comprehensive and has a very strong database of metabolic formulas. Once you have input the formula recipe, step 3 is analysis. You can see here that we were able to not only pull the macronutrient distribution of the formula, but also a specific amino acid breakdown. In this case for homocystinuria, I specifically chose to draw out the amount of methionine that the metabolic formula was providing. Moving on, once your patient and their family has a good base knowledge of their disorder, they may want to take their learning and understanding to the next level. The last 2 sections under homocystinuria specific resources are diet management tools for patients and families and recipes and cookbooks for homocystinuria. It's cool to note here that the cookbook Apples to Zucchini is also linked again under homocystinuria. I mention this because it's nice to see that there is some continuity in resources available for different disorders that require similar nutritional management. The next slide will highlight 2 of the diet management tools for patients and families, the Metabolic Diet app and the ASIEM Low Protein Handbook for homocystinuria. The left-hand side of the slideshow shows the Metabolic Diet app. As you can see, several disorders are available. For the homocystinuria family that wants to utilize the Metabolic Diet app, they would need to create an account to utilize this website. The very right-hand side of the slide shows the ASIEM Low Protein Handbook for Homocystinuria, which is a very comprehensive handbook and has several different sections that go into specifics of the nutritional management of homocystinuria, such as nutrition management through the life cycle and travel preparedness. A quiz is also included in this handbook, so patients and their families can test their knowledge. It's always very great when patients and their families want to get involved in support groups. In the homocystinuria specific resources, there is a section dedicated to homocystinuria support groups. There are hyperlinks to different organizations to help your homocystinuria family connect. There are both specific homocystinuria support organizations, like the Homocystinuria Network North America and the Homocystinuria Network Australia, in addition to NORD. Thank you so much for following along with case example number 2. I will now turn it over to Emily, who will wrap up the webinar and answer questions.
That was great. Thank you, Nancy and Mary and Chanel, for your excellent presentations. Now we can open it up for questions. While we were waiting, I just want to give a huge shout out to our education committee members, both past and present, for bringing this website to life as a resource for all of us. Our committee is in the process of adding resources that have been created by GMDI members to be accessible for other members to utilize. So far, we have added some educational materials in different languages that have been submitted by our international colleagues. We also have collected several other resources from the metabolic listserv that we plan to include in this section of the website. This is hopefully our answer to the emails we repeatedly send on the listserv saying, we'd hate to reinvent the wheel, but does anybody have XYZ? So if anybody has any great education materials that they would like to share, please send any of those to info@gmdi.org, or you can send them to our education committee, and you can find our addresses on the GMDI website. Also, if anybody has ideas for future webinars, please feel free to share those with us as well.